prayers will remain with their loved ones. We've also had nearly 3,500 cases of COVID-19 in our community and 17,000 statewide. This virus is very much a part of our lives, and it will be with us for the foreseeable future. Because we have a lot of ground to cover here today, we're going to try to do something a little different. Following this press conference, we will be hosting a webinar with more information on everything we're going to talk about today. As you know, the state began a phased approach to lifting Colorado's stay-at-home order last week. In coordination with our neighboring communities, we determined we needed additional time. Because we are an urban center surrounded by dense communities, we have tried to move as a region, informed by public health experts in the metro region. We have underpinned our decisions on what the city's public health team, by the advice of the public health team here in the city of Denver. In the absence of a national strategy on testing, I wanted to use this additional time to work with local care providers and improve our testing capacity, including time to organize and train more contact tracers, tools that public health scientists say are critical to managing potential spikes in infection and support safer ways to open the economy. Here's what we're looking at right now. When it comes to testing, we now have the ability to do at least 1,000 swab tests a day, and we'll ramp up from there. We also did a canvass of hospitals and other clinics last week, and they told us that combined, they could do nearly 3,000 additional swab tests. In partnership with Denver Health, the Denver Police Department, and city employees, we are also on track to have at least 100 trained contact tracers. These efforts will give us a better lay of the land on the spread of the virus. We're going to do everything we can to help them ramp up the capacity on both sides, as well as ensure that residents in our underserved communities and vulnerable populations have increased access to tests. And I'm excited to say that we'll be launching a mobile testing process soon, and you'll hear more about that in just a few moments. More important, we have a consensus among the metro area's public health experts that we can now begin our phased approach to lifting Denver's stay-at-home order. With some additional measures I will describe to support physical distancing in our neighborhoods and workplaces. Denver residents have played a big part in getting our city to this point by staying at home, limiting their contact with other people, and wearing a face covering as much as possible. It's the people of Denver who have really leaned in to slow the spread of this virus. Based on our residents' efforts, the data we're seeing, and guidance from public health experts, we feel comfortable at this time not extending Denver's stay-at-home order beyond this Friday, May 8th, and starting the phased reopening of our city beginning on Saturday, May 9th. So here's what our residents can expect going forward. As you heard last week, a face covering requirement in certain public settings goes into effect tomorrow. A face covering doesn't have to be a surgical or N95 mask. It can be a bandana, a modified T-shirt, some of your ski gear, or clothing covering you can make at home. As long as it covers your nose and mouth, it'll work. This goes for anyone over the age of 3, except for people who have a medical condition that would prevent them from being able to wear a face covering. Residents and employees will be required to wear face coverings while inside of or waiting in line to enter certain businesses or locations, including any retail or commercial business, their common areas and enclosed spaces like an elevator, any government building where essential public functions are taking place, at a bus stop, on the bus, or in a ride share or car for hire, and facilities offering healthcare services. To be clear, you don't need to wear a face covering if you're out for a walk, exercising outdoors, or driving in your car. It's only for certain public settings, the certain public settings that I just mentioned. But I still strongly recommend, and I want to say this very clearly, I strongly recommend wearing one when you're out and about. We see a lot of residents and businesses already starting to make face coverings as part of their routine. And I want to tell you, today I wore one in, and several other people have this one made by a gentleman named Randy. He's a Denver business making ski vests, and he decided to transition his business during this time to help make face masks. So we want to thank Randy at Kinder Lift of Colorado for making these face masks for us going forward. And so we appreciate the fact that this has become routine for many people and many businesses already. And so I have faith that through voluntary compliance, folks will follow. I want you to look at it this way. When I see people wearing face masks, I recognize they're working or doing everything they can to protect me. When I wear my face mask, I am doing what I can to protect them. And so this can, as it becomes part of our new culture, it's a great opportunity for us to thank our neighbors, to thank those that we see wearing the mask or face covering in public. Simply say thank you, because they're taking the steps to protect you. I am confident that the people of Denver understand that we are living in extraordinary times, and extraordinary measures are justified. For those who are uncertain about how to acquire face coverings, there are many resources available on how to make a face covering, and we're going to have those listed on our city website, denvergov.org. Now for reopening. So we have as much continuity as possible. We will be aligning with the guidelines laid out by the governor in his Safer at Home phase. Starting Saturday, these businesses can start to reopen. Offices with only 50% of their employees on site and 6 feet of physical distancing between them. Retail businesses with only 50% of their employees on site and 6 feet of physical distancing available between customers. Places like hair and nail salons, tattoo parlors, pet groomers, and personal trainers with 10 or fewer people in a single location, or a maximum of 50% occupancy, whichever is less. By appointment only, with no walk-ins, and strict requirements for PPE and physical distancing. The eye doctor, chiropractor, or other limited healthcare facilities with 10 or fewer people in a single location, or a maximum of 50% occupancy, whichever is less. And by appointment only, no walk-ins. Services that must be done on site, like in-person real estate showings, and our college campuses and buildings. I also want to reinforce the state's direction. If you're a business or an office that can reopen, but can still operate with your employees working from home, we strongly encourage you to do that. In order to reopen, businesses must have several protective measures in place to keep employees and the public as safe as possible. Employees and customers should start to see things like special hours for vulnerable populations, 6 feet of physical distancing between people, symptoms, and temperature checks, and closure or frequent disinfecting of common spaces. These and other requirements for reopening will be available for review, again, on the city's website, denvergov.org. While we're excited to see parts of Denver's economy start up again on Saturday, I want to remind everyone that many establishments will remain closed for the time being. These include restaurants and bars, except for curbside pickup and delivery, movie theaters, live performance theaters and concert venues, stadiums and arenas, gyms and yoga and fitness studios, with very limited exceptions. Those stores on the inside of malls that don't have outdoor public entrances and exits, outdoor recreation facilities such as children's playgrounds and tennis and basketball courts, and city recreation center and libraries. As per state's order, large gatherings above or more than 10 people will still be prohibited through May 26th. While we navigate our way through this transition period, with some businesses reopening and others still closed, we still have a lot of work in front of us. And I want to be as candid and transparent as possible. I'm not going to mince my words. As a city government, we're going to have to make some tough decisions when it comes to our budget and general fund, so we can maintain essential services for our residents. Right now, we're looking at least $180 million gap from lost revenue and likely more. That's a gap that can be filled, that can't be filled without some sacrifice. Thankfully, the measures we put in place well before the pandemic hit, like maintaining reserves at a healthy level, have given us a little cushion, but it didn't fully shield us from the challenges. That's why last week I sent a letter to our Colorado congressional delegation urging them to include direct funding relief to cities and states in the next stimulus package. This relief, if our representatives and senators can get it done, and we trust they can, will be critical to our recovery. Because if our cities cannot provide basic services and recover sufficiently, there will be no national economic recovery. Let me give you another example. In our nation, our metro regions made up primarily of urban cities constitute 91% of this nation's GDP. We must get our cities on a fast track to recovery. It also means doing everything we can to help our economy get back on track, in addition to working with our cities, but continue to work with our workers as well. To do that, I have formed an Economic Recovery and Relief Council, which will be chaired by Grant Thornton's Lori Davis, to bring forward actionable recommendations to support the relief, recovery, and stabilization of the Denver economy. The council is composed of business and community leaders across industry sectors and is organized into 4 subcommittees. Subcommittee 1 represents small and medium businesses. Subcommittee 2, large employers and anchor institutions. Subcommittee 3, construction and development industry. And Subcommittee 4, restaurant, entertainment, arts, culturals, and hospitality. Their sole focus is going to be how we help our businesses and workers get back on their feet. I want to thank Lori for stepping up to lead this work and everyone who has agreed to be a part of this effort, and there are dozens of people who are participating. Lori and our Economic Development Chief, Eric Haraga, will be going more in depth on this work during the webinar following this press avail. I just want to finish up by saying how proud I am of the Denver residents and how they've handled this whole situation over the past few months. Their willingness to do what was needed really has made all the difference in helping us to stabilize this situation. Saturday might feel like we're taking small steps forward, but it is progress. I join everyone in hoping that we can keep moving forward and don't have to go backwards to a stricter stay-at-home order. I'm going to continue to taking all of us. It's going to continue taking all of us to do our part to stay safe and stay healthy. And that's how we're going to remain on this side of the curve and continue to stabilize the virus. Now, a reminder that following this presser, we'll be hosting a webinar to go deeper into these topics. But for now, I want to turn it over to Bob McDonald, our Public Health Administrator, for more on our efforts on increasing testing and contact tracing.
Thank you, Mayor. I want to thank everyone who's able to join us today, whether in person or virtually. I want to spend a little bit of time explaining the data in the slide that you see behind you. That chart is a chart of case counts, COVID case counts on a daily basis in the city of Denver. And there's a lot of discussion about what that data means. And there's been suggestions that before we ease up on any orders or restrictions, that there should be a decreasing case rate. Some of it has suggested there should be a stable case rate as a minimum. And some of it suggested that the real indicator there is that you can ease up when you no longer see cases increasing. So I want to spend some time discussing that. We are in a good place right now to take the next step. When you look at the chart behind me, it begs the question, we're seeing case numbers go up from when we first saw it as we started going into this battle with COVID-19. But I would also remind everyone that we've increased testing. So when you increase testing, we are going to be able to identify more cases. So that's a good thing. That is just one metric that we look at. We don't look at just one metric and make decisions. There are a number of different metrics that we need to understand and analyze and be thoughtful before we take the next step. So while the case numbers seem to be going up, another metric that we look at very closely is hospitalization rates, which is on the next slide. That's something that we've been focusing on, is just not are cases manageable. Can we keep up with the investigation and the contact tracing, but also where do hospitals stand? I was just looking at the data this morning, and while it's not reflected here, I'm happy to report that case admissions, hospital admissions, are as low in the last couple of weeks as they were in the beginning of this, which I think is testimony to the fact that Denver got out in front early on this. We implemented the stay-at-home order very early, faster than many other communities did where the virus was embedded into the community already. That's why we see case numbers stabilizing. That's why we see hospital admissions at a very low rate. I want to review a little bit on the next slide what we said we were going to accomplish in the last couple of weeks of our stay-at-home order. We needed to increase testing capacity, as the mayor had mentioned. We have now identified many of those sites where they are. You can go to our website or the city's website to find out where they are. We wanted to focus on contact tracing, and I'll talk about that in a minute, about what that looks like, where we stand with that. And I'll talk even more about the case management process. Our goal was to train up to 100 contact tracers and case managers for this effort. We have 45 being trained, 45 individuals just being trained today. So those were some of the things that we said we were going to do, is focus that this last 2 weeks of our stay-at-home order has been really critical, and I feel in a much better place now than we were a couple of weeks ago, and I'll go into that in a little bit in more detail here on the next slide. We talk about where we stand with testing. The mayor had mentioned that there are up to 1,000 tests now being done in our community, and we have the capacity to do thousands more. Very, very early on, I would remind everyone that testing capacity was very limited. And so we were urging people to stay home, rest up, get past your symptoms. Not everyone has to be tested or should be tested, given that there was limited testing capability. We've overcome that now. And so now that we have the capacity to provide well over 1,000 tests, we're going to launch a marketing campaign redirecting people on how they can get tested and where they can get tested. We also know that regardless of how many sites we set up throughout the city, there will always be people who are going to struggle getting to those sites, either because they're too ill to get to those sites, they're elderly, or they have other complications. So the mayor had mentioned earlier, and I'm proud to announce that today we are launching our Wellness Winnie, our public health mobile unit, to bring that testing to our underserved communities. That launches today. And over the upcoming weeks, we're going to work with the Department of Safety and other partners to launch up to 7 units to serve our underserved communities. We need to get that testing where people are. We'll have that testing done in the community, at their doorstep. That test will be administered. We'll take that sample to the lab, and that lab will run the sample and report back to the individual that was tested. All of that without that person ever having to leave their home. The way this works, people are interested in this can visit Denver's website, denvergov.org, and all the testing sites will be listed there, and there's also an option there to explore mobile testing. People will call 311. There'll be just a few questions that are asked to see if they qualify for that mobile testing. And then once that information is received, that will be reported to the Department of Public Health's Operations Center, and we will deploy somebody that day to that home to get that testing done. When the Wellness Winnie is not reporting to individual homes, if that's not needed, we're going to deploy to those gaps within the city where there are not brick and mortar facilities, again, to reach out to those communities that are having trouble reaching the testing sites. On the next slide, you'll see that there's still a requirement to have a referral from a doctor. So that's a challenge. That's a hurdle for many in our community. We're exploring a standing order, either from our partners at Denver Health and Hospital Authority or at the state level, much like we had with naloxone. Have a standing order. Anybody who needs a test can get a test. We want to lift as many barriers as we can. That's just one thing that our department and many partners are doing to address the inequities that COVID-19 has, the disparity and the disparate impacts that it has on our underserved communities. We've worked very closely with DPD, again, to expand on those mobile units, and DPD has launched now for a number of weeks what they call their Compassion Cruiser. That is a vehicle that goes out into underserved communities to give away masks and sanitizer to those who need it. So we've done every step of the way with every decision that's been made in the Emergency Operations Center and with all of our partners. Equity has been at the forefront of those decisions, and we're launching many things to bridge that gap in our communities that are struggling with the resources to battle this. On the next slide, I'd like to go into a little bit about the contact tracing that we spoke about. We had, our goal, again, was to train up to 100 people. We have already begun that training with our partners at Denver Public Health. They began that training last week. There was a training today. 45 people alone today signed up for that training. Many of those from our partners at the Department of Safety, but even other partners, other partnering agencies throughout the city, Community Planning and Development, City Attorney's Office. They reached out to the Public Health Department saying, how can we help? We want to be able to help. And now we are having even more volunteers sign up for that contact tracing and the case management effort. That's critical to build that infrastructure. And this last couple of weeks, that's what it has done for us. We've been able to set up the structure for that training, and that training is now underway. So as we ease up on the stay-at-home orders, eventually and slowly and thoughtfully, what replaces that is a very targeted system that reaches out to people who have tested positive. There's an interview that's conducted with them, and part of that interview identifies the contacts that they have been in touch with, and then contact tracers reach out to them. It involves hundreds and hundreds of phone calls and a very solid workforce, a comprehensive workforce. As a part of that contact tracing, then all of those people who are at risk and potentially need to be isolated will be isolated. And then we monitor their symptoms, and if they become positive, then we get them tested, and that carries on. Then we reach out to the contacts that they've had, and so on and so on. By doing that targeted contact tracing and that targeted isolation, that's how we replace this broad stay-at-home order. On the next slide, I want to talk a little bit about where we stood with the last weeks, many weeks that we've been under the stay-at-home order. I want to also thank everyone, every citizen in Denver, every business in Denver that has got us to where we are today, managing the number of cases that we have by complying with the stay-at-home order, by doing everything that they can to manage this epi curve. I want to thank our partnering agencies who have reached out to help us out with this effort. As we move into the next phase, it's just as important that everybody comply. We do not want this to get away from us. You can see the enforcement numbers there. We've been very aggressive with thousands and thousands of visits being done to assure compliance with the stay-at-home order. Our goal is to achieve compliance and to maintain compliance. Enforcement is an option, but we try not to go there immediately. We always want to go with education first and to address those barriers that people have with compliance. Sometimes that doesn't work, and we've had to issue some citations and many warnings. But overall, I think we've been very successful with where we are today, both with building out that capacity, building up the contact tracing, monitoring our epi curves to make sure that case numbers are not going through the roof, hospitalizations remain low, and we have done that. We have done everything that we have. So I want to thank the mayor for extending our stay-at-home order to get us prepared for the next step. And with that, I'd like to turn it over to Dr. Connie Price with Denver Health and Hospital Authority to talk about what that next phase looks like.
Great. Thank you, Bob. So first, I want to offer my heartfelt thanks, both as an infectious diseases physician seeing patients on our COVID wards, as well as the Chief Medical Officer of Denver Health. Through your hard work, we have ensured that Denver's capacity to take care of those with the most severe disease from COVID requiring hospitalization, that we have the capacity to care for them in the way that we should. That has bought us time to trial new therapies and to see new promising therapies emerge as a result of the time we have been given. We've also been able to expand our testing capacity, as you've heard from both our mayor and our director of Denver Public Health. And although we've had much progress and we're starting to see a decline in those hospital admissions, there are still special populations that we have to be very careful to continue to protect in the greatest way possible. And we need to be vigilant to make sure that those populations don't develop the severe disease that would overwhelm our healthcare system and put them at risk. So these populations at high risk for severe disease include those over the age of 65, and the older, the more at risk you are, particularly over the age of 80. Those with chronic medical conditions, particularly heart and lung conditions. Those with weakened immune systems due to therapies to treat cancers or to infections from HIV. And those with severe obesity, usually defined as a body mass index of over 40. If you fall into one of these risk groups, the best way to protect yourself is to continue the existing shelter in place that the mayor had put in place in Denver weeks ago, and continue to do that with the greatest extent possible. That is not to say that you should avoid seeing the doctor for your existing medical conditions. It may be possible and prudent to do your visits with your physician via telehealth or by video conference. If you need to get vaccines, you should not delay those, and those can be arranged with an appointment at your physician's office. It will be especially important as we go into the fall and flu starts emerging. We don't want to have double risk of these infections occurring in our most vulnerable populations. And really just make sure that you also continue to have your medications always on hand and filled in the case that you can't go out to get them. Have a loved one provide you with those medications, or you utilize mail order services for those. Through this, we'll buy ourselves some more time until we can get that therapy or that vaccine that we're so wanting to have very soon. Thank you.
Thank you, Dr. Price. Next, we're going to have Matt Muller, who is our Executive Director of the Emergency Operation Management at the City of Denver, talk about the transition of the Emergency Operations Center.
Great. Thank you very much, Mayor. So first, I want to start off by talking a little bit about personal protective equipment, or PPE. The City and County of Denver is doing better now than we were 1 month ago. PPE are the masks, gloves, gowns, face shields that our healthcare personnel and our first responders use daily. We're seeing improvements in the supply chain over the past month. We're able to procure more on our own, and we're not solely reliant on the push of the strategic national stockpile from the federal government. Consequently, we no longer have to immediately push everything out to the hospitals, care facilities, and first responders. To give you a comparison of where we are now versus where we are several weeks ago, you can see a comparison on the slide. For example, as of May 4th, we have received more than 340,000 surgical masks. However, even though we have seen improvements to the supply chain, it is still taking 2 to 3 weeks to get in shipments of PPE. Thus, it's critical that we build our inventory up over the next few months so we can be prepared for later this year when most models show that we'll have a resurgence of cases. Finally, I'd like to talk a little bit about our transition from emergency operations phase into the recovery phase. Our Emergency Operations Center, or EOC, is where we manage logistics, public information, sheltering. We support our hospital system, We monitor critical infrastructure and our supply chain. We started with over 90 people in the EOC in early March, and over time, when it became clear for the need for physical distancing, we're now down below 20, with the rest working virtually. We continue to do temperature checks with everyone wearing a mask. As we move forward, we're now assessing the transition from our EOC to our new normal of business operations within the city. We'll transition to a more sustainable, long-term recovery structure. However, as we begin the transition to the recovery operations, our goal remains the same: keep people safe and healthy. With that, I'll turn it back over to the mayor.
Think you, Matt. And again, let me thank everyone for joining us today. Again, following this presser, we will have a webinar where we'll dig deeper into these as well as other topics for discussion and hopefully give greater guidance to the public. Let us open it up now for question and answer.
Mr. Mayor, this is Vicente Arenas with Fox 31. Can you tell us when restaurants and bars will be able to open in the city of Denver?
There is no schedule, Vicente. Thanks for asking that question. There's no schedule at this point in time for restaurants and bars to open. We still have the social distancing order in place until May 26th. That is established and issued by the governor. And we're going to be, we are aligning ourselves with that order. But I can tell you that last night, the governor and I spoke about this. This is one of the areas that we are continuing to analyze and to figure out how we can help our restaurants and bars begin to open up. But there's no set schedule at this point in time.
Mayor, this is Liz Gilardi with Denver 7 News. I was wondering, kind of to that point, what would you tell business owners that are trying to, plan for their future right now?
Well, first of all, I would ask them to go to the Denver Gov website or to the state to determine if their business is eligible to open now and under what restrictions. In terms of businesses that will remain closed, your bars, your restaurants, this is a process that we said will be a slow rollout and that we have to analyze under the guise of public health and safety how and when we open up restaurants. We are turning to many of the industry professionals to give us some guidance as well on how we can do this effectively while keeping everyone safe. And so the Economic Recovery and Relief Council is leaning in to help us to understand what we can do and think of creative ideas, as well as our ongoing communication and alignment with the state. All that will inform, of course, how we do this. And right now, while I can't tell you when we'll do certain things, just know that this is a journey and it's going to be a marathon. It's not a sprint. How we roll this out, the goal is to continue to flatten this curve and to make sure that when we do open up businesses, it doesn't do anything to spike the numbers.
Hi, Mayor. This is Esteban Hernandez with Denver. I just wanted to ask you, what is enforcement going to look like for face covering? I know the city has emphasized education, but what is that going to look like for residents who aren't following the order?
Well, listen, here's our hope. Again, I want to start with the foundation that this is an order of the city of Denver that you wear a face covering when you're in public, particularly when you're going to these public venues. Again, you don't have to wear them when you're in the park, when you're on a walk, when you're exercising outdoors, although we strongly encourage you to do so. But if you're going to a place where you're required to wear a mask, businesses will be asked to lean in and to help enforce the rule. But there's nothing stronger than the fact that we all have a social responsibility to one another. Again, you wearing a mask protects me and everyone else around you. Me wearing a mask protects you. And so the culture to build is one of appreciation and one of social responsibility. Thank you for wearing a mask is what you should be saying. We shouldn't default immediately to enforcement, although we will be out enforcing. But the goal is for all of us to comply with this order because it's our responsibility to one another to keep each other safe, keep each other healthy. And that's what this order is about, as opposed to strict enforcement and strict citations. We're going to be there. We're going to warn. We may even cite for people who don't want to follow the rules. But the goal is to get people to comply based on the value of social responsibility to one another.
Hi, Mayor. This is Connor from Westward. I have a follow-up question. One at a time.
Dave, let me jump in there. I have a good follow-up question. So, thanks, Dave. So just going off of Esteban's question, so I've been speaking with grocery store stakeholders, and they're pretty concerned about how enforcement of the face mask requirement for customers is going to happen. And they brought up the recent tragedy in Flint, Michigan, where a security guard at a Family Dollar store was shot and killed when he was apparently trying to enforce the customer mask requirement. So my question is, how can store employees balance between enforcing the city's mask requirement while also keeping themselves out of harm's way? And
yes.
Also a follow-up to that is, have you thought about sending off-duty DPD officers or even National Guard to grocery stores to help with that?
I'm going to ask Kristen Bronson, our city attorney, to weigh in on the question.
Sure. Good afternoon. This is Kristen Bronson, Denver City Attorney. In response to the question about enforcement, we are asking businesses to ensure that folks that come into their store as customers are complying with the order. But we also understand that they can't get in. We don't want them getting into confrontations in their place of business. We want businesses, and we expect businesses to make a good faith effort to get those that come into their stores to comply. We also expect customers to make a good faith effort to comply. If we go to a store and we see no signage about the face covering order, and we see 100% of the people in that store are not wearing a mask, I would suggest that that is probably not good faith efforts to comply, and that is probably going to be a situation worthy of a citation. But if you go to a store and the vast majority of the people in that store are wearing a face covering, they've been asked to wear a face covering, the employees have been advised of the face covering order and trained to some degree, and there's signage. That's a good faith effort on the part of the business. We certainly understand we're not going to get 100% compliance 100% of the time, but we're asking everyone, customers and businesses, to exercise good faith for this important public safety ordinance.
Thank you, Kristen. And let me say this again. I want to applaud city residents and our visitors who are wearing masks. This weekend I had the opportunity to go to several stores, and I can tell you 99, 98, if not 100% of the people were wearing masks. Thank you for doing that. Again, I recognize you're keeping me and everyone else around you safe, and in return, I have an obligation to do the same thing. That's the goal. Notwithstanding the tragedy that occurred recently, or the stupidity of the individual who decided to wipe his nozzle on a worker in a grocery store somewhere else. This is about those of us who care enough about humanity and about each other to comply. And it's pretty easy to comply with a shirt, with a bandana, something that covers your nose, covers your mouth, to help show it's a symbolic gesture to your neighbor that you care enough about them to wear a mask. And that's what we're asking everyone to do.
Mr. Mayor, this is Dave Sachs with Denverite and CPR. This question is about testing. You guys have talked about capacity, but this is a two-part question. How many people are getting tested compared to the capacity? And then a follow-up to that is, how much do those tests cost for the mobile testing unit?
I'm going to ask Bob McDonald to weigh in on this question, but let me say this. This was a two-part effort, really a three-part effort during the 3 weeks that we were departed from the state order. One is we wanted to increase our testing capacity. Two, we also recognized that we had to increase our access and coordination of testing. And we're still in the process, as Bob alluded to, as far as increasing our accessibility for all residents who need testing. So, Bob, I'll let you weigh in on that, but I wanted to lay the groundwork.
Sure. So I look at that data every day. My staff members collect that data from healthcare providers and even some in the private sector that are retailers who are actually providing that testing opportunity. The last I looked, I think it was yesterday or the day before, close to 1,000 tests had been administered. And as was mentioned earlier, the numbers that I looked at recently, just under 4,000 tests a day could be administered. So many more tests can still be done. And we'll be marketing heavily the use of our wellness, Winnie, and other areas, other venues where people can go. With respect to cost, I know that, unless I'm mistaken, those tests are free at Denver Health and Hospital Authority, but I can certainly tell you that for those that are receiving that service from our Wellness Winnie, that test will be free. There will be no charge for that. It'll be immediate. It'll be free.
And what's taking the standing order so long? Why is it so hard to just, say, hey, anyone who needs a test can get one? Why is this such a hurdle? Because I know you guys have been working on this for at least a couple weeks.
Yeah, I don't know if I'm prepared to answer that question right now. I will tell you that it is more complicated than I can speak to right now. We have been working on that. I think the question is whether or not that'll happen at the state level or whether we can partner up with Denver Health and Hospital Authority to do that. We are aggressively pursuing that because we know that right now, as it stands, there is a physician's order that needs to be in place to have that testing done. So that is another thing that we're aggressively pursuing, and I'll be looking into that in the next couple of days to see if we can move that forward even faster.
Dr. Price.
Yeah, and I can add on to the delays in getting testing up and running. Largely, it's a supply chain issue. National shortages of the media and the collection kits to run these tests. So even if you can get the test available, if you don't have the media, if you don't have the equipment to collect the specimen correctly, then you can't run the lab test.
Thank you, Dr. Price. And I can, in talking with several hospital administrators, when the question of testing came up and our capacity, it was clear that as a city and really as a region, we had the capacity. It was a supply chain. The 3 out of 4 of those administrators said, can you please help us with that? If we can break through the supply chain, we can test many people. And so it's not that we haven't been working on it. It's been trying to compete with all that's going on around the country and all the demands on the supply chain from around the world, quite frankly, that we've been having to need to break through.
Last question.
Mr. Mayor, Lori Lizarraga with 9 News. I just had a question about, we're seeing finally restrictions being lifted now this coming weekend, but what would have to happen for restrictions to move backwards and for enforcement to come back, and are you prepared to do that in the city of Denver?
Yeah, let me just generally say, and of course I'll turn over to Bob, from a leadership standpoint, the regional collaboration and partnership with public health administrators is very, very helpful in terms of their guidance, on terms of metrics that we'll be looking at to determine if we're continuing on the right path in terms of stabilizing the situation. Our hope, of course, is that we don't have to turn back, and that if we have compliance, if we have people continue to do the things that we've all been talking about in terms of exercising physical social distancing, wearing a mask when in public, washing your hands, having sanitizer available, readily available in the workplace or on your person. Those are the things necessary, we believe, to continue and of course not going out if you don't have to. That's the other part. But I'll turn it to Bob in terms of the metrics that the scientists and medical professionals will be looking at.
Yeah, so there are at least a half a dozen metrics that we look at. You don't look at any one of those by itself to make a decision on what the next step may be, whether you ease up further or whether you put more restrictions back in place. I can tell you that generally speaking, as you start to ease up on some of the restrictions, you monitor data very closely every day. If we see cases going up, spiking 5 days in a row, again, generally speaking, that's an alarm for us. I mean, a spike 5 days in a row, right? But that's not the only thing we look at. I mean, if cases increase and as testing increases, we expect to see that. That's why we don't just look at testing. We look at hospital admissions and are they still able to handle the caseload within the medical setting. So every day we look at it. If we see consistent increase in numbers, significant increase in caseload, then we look at the other parameters, and then we make a decision about what we need to put back into place. Generally, again, when you move from one phase to the next, there's perhaps a 30-day window there because we want to cover a 14-day incubation period on the long end. Then we need to collect that data. We need to analyze that data. And then we have to plan if the numbers still look good and we can ease up even more restrictions. We have to talk about what that looks like and work with our stakeholders to put those things in place. So in summary, a 5-day swing is going to be a cause for alarm if those metrics start ticking up, and a 30-day window to try to make a decision on easing up on the next step.
All right, we got to take a brief break to allow for the setup for the webinar. We'll be back at 2 p.m. for the webinar. Please join us where we'll dig deeper on some of these subjects that we just discussed. Thank you all.
That is Denver's Mayor Michael Hancock wrapping up the news conference that he says will not see the city and county of Denver extend the stay-at-home order that will now expire come Friday. There will be added the face covering requirement in place, and that'll start tomorrow. There were questions about enforcement. There will be more questions about enforcement of that as well. He was joined by Bob McDonald, Dr. Connie Price, and Matt Muller as well from the city, talking about the status of COVID-19 in Denver, which certainly has been the hardest hit part of the state as far as sheer numbers, whether it comes to cases or, in fact, deaths. Another problem, as he delved into a bit about restaurants and bars and when they may be able to open, certainly has to do with the economy. And the mayor talked about the city facing some very tough decisions, as he called it, with the budget, talking about a $180 million gap now in lost revenue, saying that $180 million could actually be higher. So there is a lot to digest. We'll be taking a look at what the mayor had to say today in the state of COVID-19 in Colorado and the city of Denver, coming up on 4 o'clock at 9 News.